We focus on real-world evidence, observational, and have been used across R&D and also commercial settings for patient data capture. We've worked in the field of oncology, recently having done a project with the Christie Hospital at helping patients track their symptoms and also provide feedback on their experience as well of their treatment pathway. What's important is to help patients manage their condition better. And being focused on that. There's literature and research that shows that being able to manage symptoms actually helps patients achieve better outcomes. There was a study by Ethan Bash presented at ASCO that showed a 5.5 median month improvement in survival rates based on tracking symptoms and having those linked to patient care. We also know that symptom tracking and diaries and reminders help improve patients' experience of their care, help them manage their treatment, but also help them get better consultations. There were some good questions that came up around how to make this as easy as possible for the patient. And what we believe at uMotif is that it's having consumer level design. This has to be something that patients want to use, it has to be desirable, and it has to be giving them benefit, as a result of which they're much more likely to engage with their condition, they're much more likely to use the application that we produce, or any technological application. So it's that patient experience and that user experience that's absolutely crucial, and designing with that patient or user in mind. So there's various different areas of benefit. Obviously, we've talked about the benefit to patients in terms of being able to manage their condition better or having greater insight into their condition and track and manage their symptoms. There's benefits to the healthcare professional as well, because it's a new data source for them to use. They now can see how the patient's been doing over time and have greater insight into the effect of the treatment on the patient in terms of how the patient views their symptoms. And creating that deeper relationship as well. There's benefits to the wider ecosystem as well, whether it's healthcare providers in terms of having better support, more data to make decisions, but also massive opportunities for research. So as a result of patients tracking their condition, tracking their symptoms, there's almost a secondary benefit or secondary outcome of all of this data that's ready for analysis, whether that's real-world observational studies or even using this approach in more clinical studies.